Okay, imagine this. A parent calls the ER after their 7-year-old trips on the sidewalk, bangs her head, cries for a bit, then is acting normally. No vomiting, no loss of consciousness, speech is fine, and she's moving all limbs. The ER orders a head CT to be safe. The CT comes back normal, but the family leaves worried about radiation and wondering whether that scan was really needed. I see cases like this all the time, and honestly, it's a perfect example of how good intentions can turn into avoidable testing and anxiety.
Hi, I'm Jessica, Nurse Jessie, and welcome to FAQ by Nurse Jessie. Let's separate medical fact from fiction. Today's promise: in the next 18 minutes, I'll demystify X-ray, CT, MRI, and ultrasound, give you plain language comparisons about radiation and contrast, teach you short scripts you can use at the bedside, and share a short checklist you can download to help decide when imaging matters. I'll also introduce a new recurring tool, Jessie's 90-second scan score, to quickly rate whether a scan was necessary and why.
First up, Jessie's 90-second scan score applied to that micro case. Score 2 out of 5. Why a 2? Because this was a low-risk mechanism, normal exam, and no red flags. The scan added information that didn't change management, but did add radiation and stress. Bottom line, observe at home with clear return precautions, not an immediate CT.
All right, quick primer. What does each test actually show? X-ray is great for bones and big structural problems, fractures, collapsed lungs, that sort of thing. It's fast and low radiation. Decision prompt. If you're worried about a broken bone or a big structural issue, get an X-ray. If it's soft tissue pain without deformity, consider clinical exam first. CT scans give detailed cross-sectional images and are excellent for detecting bleeding, complex fractures, and certain chest or abdominal emergencies. They do use more radiation than X-ray, but they're fast and often change urgent care decisions. One-line decision prompt. If rapid, detailed information about bleeding or internal injury will change immediate treatment, CT may be appropriate. If not, consider alternatives. MRI is the heavyweight for soft tissue, brain detail, spinal cord, joints, and many neurologic issues. No radiation, but scans are longer, can be claustrophobic, and aren't always available in emergencies. One-line decision prompt. If soft tissue detail will directly change diagnosis or long-term management and time allows, MRI is preferred. If you need immediate answers about bleeding, CT is faster. Ultrasound uses sound waves, no radiation, and is great for watching fluid, blood flow, and many abdominal or obstetric questions. It's operator-dependent but portable, and often the lowest risk first step. One-line decision prompt. If you need to check fluid or blood flow quickly and non-invasively, ask about ultrasound first.
Now, radiation and contrast in plain English. A typical head CT has a radiation dose that I like to frame as roughly equivalent to a few days to a couple of weeks of natural background radiation, depending on the scan. That metaphor is for perspective. It's not zero risk, especially with repeated scans, children, or pregnancy. Contrast eye helps certain images, but can cause allergic reactions or affect kidney function in vulnerable patients. One-line decision prompt. Balance urgency and likely benefit. If imaging will change treatment now, the benefits usually outweigh small risks. If it won't change management, consider waiting or lower-risk tests.
Practical alternatives and trade-offs. Sometimes observation with a return plan is safer than immediate imaging. Ultrasound can replace CT for certain abdominal or pelvic questions. Delayed imaging, rechecking symptoms in 24-48 hours, is reasonable when stable. How to request these options. Here are 2-line scripts you can use at the bedside.
2-line script option A. I'm worried about radiation. Can we try an ultrasound first, or watch for 24 hours and recheck unless my symptoms get worse? I also asked a radiologist what they wish patients knew. Here's the essence of that 20-30 second clip. Radiologists say imaging truly changes management when it answers a specific clinical question that will alter care. For example, confirming active bleeding, showing a large stroke that might qualify for a clot treatment, or identifying a mechanical obstruction needing surgery. They also wish patients asked, "What are you looking for?" And how will this result change what we do?
What to expect during common scans. Quick prep tips. For CT, bring a current medication list and mention allergies or pregnancy. For MRI, tell staff about implants or claustrophobia. Ask about headphones or sedation if anxious. For ultrasound, often no prep, but sometimes an empty bladder is needed. Simple steps to make studies more useful. Note exact symptom timing, when it started, how it's changed, and whether symptoms are constant or intermittent. That context helps interpretation. Back to the printable what to say card. Include your 2-line scripts, 1-line decision prompts, and the red flag checklist I'll mention in a minute. To use it in clinic, hand it to the clinician or read it aloud. Something like, I brought this card to help us decide if imaging is needed today. It's short, neutral, and framed around safety.
Red flags that still need immediate imaging. New focal neurologic deficits like weakness or trouble speaking, repeated vomiting after head injury, unstable vitals, severe uncontrolled bleeding, or signs of sepsis. If any of those are present, imaging now can be life-saving. Repeat checklist. If you see those signs, don't delay. If you don't, consider lower risk options and discussion. Jessie's scan score, quick refresher with 3 examples. Scenario 1, minor ankle twist with no deformity but persistent pain. Score 3, consider X-ray if you suspect a fracture. Otherwise, try rest and reevaluate. Scenario 2, sudden severe abdominal pain with hypotension. Score 5, CT now. Imaging will guide immediate treatment. Scenario 3, chronic lower back pain without red flags. Score 1, avoid immediate advanced imaging. Focus on conservative care and reevaluate if new neurologic signs develop. 3 concrete takeaways to leave you with. 1. Imaging is a tool, not a reflex. Ask how the result will change care. 2. When in doubt, ask about lower risk options like ultrasound or delayed imaging and use the 2-line scripts. 3. Watch for red flags that require immediate imaging and act on them without hesitation. Download that 1-page checklist and the printable What to Say card at the show notes link. It's built for clinics and ER visits, so you can hand it to your care team. And if you've had a scan and are wondering whether it was needed, submit an anonymized question through the form in the show notes. I'll consider it for future episodes. Final quick note on safety. If you're pregnant, a child, or have kidney disease, mention that up front. Those groups have special considerations for radiation and contrast. When in doubt, ask your clinician to explain both the immediate benefit and the potential risks in plain language. Thanks for listening. If this episode helped you feel more confident about when scans are useful, please subscribe so you don't miss future episodes and more downloadable tools. Until next time, stay informed, stay compassionate, and always put safety first.